This is the 8th outbreak of the Ebola disease in Uganda between 2000 and 2025. And for the 6th time, the Ministry of Health has registered a case of the Sudan type of Ebola virus and subsequently a death. The ministry now is calling for vigilance and urging the public to report anybody or anyone with signs and symptoms like that of Ebola in order to curb the spread of the infection. Ministry of Health is still investigating to establish where their health worker at Mulago National Referral Hospital could have contracted the Sudan Ebola virus that led to his death yesterday.
He's a 32-year-old male nurse who was an employee of Mulago National Referral Hospital, who initially developed flu-like illness and fever symptoms and sought treatment at multiple health facilities, and these include Mulago National Referral Hospital, Saidina Abubakar Islamic Hospital in Matuga in Wakiso District, and Mbale Regional Referral Hospital in Mbale City, as well as what we established as a traditional healer.
Dr. Diana Atwine says 45 people listed as contacts within 24 hours will remain in the various isolation centers across the country, being watched for having the potential to turn into positive cases.
30 are health workers from Mulago, and 11 are family members of the deceased, while 4 are health workers in Saidina Hospital in Matuga. The Mbale team is yet to communicate to us once they've been able to conclude on contact listing.
As a quick intervention, the ministry will move to vaccinate health workers at risk and those who might turn positive while in isolation. The ministry currently has 550 doses of the Ebola vaccine.
And we shall begin with the contacts that so far we have listed, but as we work with the UN agency, we're working with WHO to help us secure additional doses.
Once infected with Ebola, one may spend at least 3 weeks before showing signs and symptoms.
Fever, fatigue, headache, vomiting, diarrhea, chest pain, and later a patient can start becoming restless, bleeding from all sides, and many times also they present with yellowing of the eyes.
Dr. Atwine says the outbreak will not have any effect on the reopening of schools for first term.
But if there is any person who is suspected, will be able to be alerted and come, follow through. Our surveillance teams are very active.
The last Sudan Ebola outbreak in Uganda was contained, and Uganda declared Ebola free 2 years ago after the initial spread in September 2022. 55 people died. Walter Mwesigye, NTV.